Welcome back to Insight. I want to learn more about Adams Health Network and the therapy they do on all ages, but especially some of the younger folks. We want to have Anthony and Emily join us here to tell us more about this. So tell me about, the sorts of diagnoses you guys do.
We'll treat kids with cerebral palsy, Down syndrome. They'll have developmental delay, to name a few. Emily might treat a few more.
Autism spectrum disorder, speech language delay, articulation difficulties in children. So
that's a wide range of
Yes.
things that we're talking about
Yeah.
here. I mean, this is
Yeah.
not just like, okay, all autism or all,
Right.
So at what age, I guess, do you start to see people?
Typically, you can start to see them at birth until about adolescence with pediatrics. That's usually about the age range. I've seen recently ages 3 to 4 to adolescence. So it varies with the age range. So.
And let's take autism, I guess, for an example. Is that primarily kind of where the work you might do? So, I mean, autism is diagnosed usually when?
Typically over the age of 3.
Yeah.
Doctors don't like to diagnose earlier than that just because kids are going through a phase of development. But typically over 3, you can get some characteristics specific to autism.
And so a 3-year-old, how do you, I had trouble dealing with a 3-year-old, just dealing with a 3-year-old.
Right. 3-year-old children with autism may have more social difficulties than a typical 3-year-old child would. Have difficulty with play skills and just difficulty interacting with their peers and adults, decreased eye contact. They may be nonverbal. So I would work with kids on getting their skills up to age level or close to.
And so that would look like once a week?
I typically serve children 2 times a week for about 30 to 45-minute sessions, and I do a lot of parent education along with that as well. So.
And in both cases, does this take place at the hospital?
Yes, we kind of each have our own room.
Right.
We have an occupational therapy room, a speech room, and then we just kind of will go from there. Sometimes we'll go outside of the room. It just kind of depends on who we're treating.
And so again, if you've got an infant or diagnosed with some of the earlier things that you had mentioned, that has to be difficult dealing with someone who can't talk back.
Yeah, and right now I'm at the age they're pretty good with communicating with me, but it's just working with them. You kind of find out from mom or dad or the caregiver what is going on with them when you see them at an evaluation, and it kind of gives you an idea what to see. You observe them, so you kind of have a good idea of what is going on.
I was told to ask what sensory disorder is.
It's basically where the brain is not being able to receive or respond input from your senses, and some of the things like proprioception, it's basically they're your roughhousers. They're needing that input from their muscles and their joints to kind of know where they are in space. Or vestibular, that's kind of the kids that have trouble with balance. Sometimes they think they're the clumsy kids. And then you'll have tactile difficulties or issues where sometimes they don't like a tag on the back of their shirt, or they just don't like the way their pants feel, or they love being messy and they don't really see it. It just kind of, it encompasses a lot.
Yeah, and I'm assuming to various degrees too, because
Yeah.
some of those things you mentioned, I had kids that had problems with, but nothing that they didn't either grow out of or
Yeah,
adjust
and
to.
lots of times it's if it ruins their day,
Yeah.
that kind of is where you really see that there's something going
All
on.
right. If somebody wants to find out more, best way to learn more is to go where?
To the hospital website or call our rehab department.
There you
and
go.
Find out.
You can find all sorts of great resources online and find out more about them at the number there on the screen. If you'd like to find out more, give them a call or check them out online. We'll be right back on Insight.